This is the Psychcast by MD Edge, where we bring you interviews with leaders in the fields of psychiatry and psychology, masterclass lectures, and inspiration to your ears, with new episodes dropping on Wednesdays. I'm the voice of MD Edge Podcasts, Nick Andrews. And welcome to episode 132 of the Psychcast by MD Edge. I am Nick Andrews. In episode 132, Dr. Lorenzo Norris, who is the editor-in-chief of MD Edge Psychiatry, welcomes Dr. Anique Forrester. Their discussion today will be underrepresentation of colleagues in academic medicine. Dr. Forrester recently wrote an article for the New England Journal of Medicine entitled Why I Stay. Don't forget, you can email the show at podcasts@mdh.com. You can follow us on Twitter at MDEdgePsych. Without any further ado, please welcome the editor-in-chief of MD Edge Psychiatry, Dr. Lorenzo Norris.
This is Dr. Lorenzo Norris, editor-in-chief of MD Edge Psychiatry. Today, we are privileged to be joined by Dr. Forrester, who I am pleased to say is right up the street from me at University of Maryland, and even better, is a consultation-liaison psychiatrist. So all is good in the world as far as I'm concerned when I heard that. So Dr. Forrester, I want to welcome you to the Psychcast, and I'm really looking forward to discussing with you your most recent article that got published in the New England Journal of Medicine titled Why I Stay? The Other Side of Underrepresentation in Academia. So Dr. Forrester, welcome so much to the Psychcast.
Thank you, Dr. Norris, for having me.
Okay. So Dr. Forrester, as I read this, if you will, this article, this point of view in the New England Journal of Medicine, and I would encourage everybody who is listening to the Psychcast, please do take a look at it. It's you can easily Google it. It is July 23rd, 2020. If you will, it came out in the New England Journal of Medicine. You can download the PDF, and I'd encourage everyone to do it because I feel so it gives such a nice view of, or a different view, I should say, that people may or may not really fully appreciate in terms of why do, if you will, underrepresented minorities choose to stay in academia, where there's been a great deal of press, if you will, and not a great deal of press on why people are leaving, which certainly there are reasons that people stay, there are reasons that people go. And really, when I think about it, it is about what paths they were choosing to walk and how we can best do that. But Dr. Forrester, can you first tell us a little bit about yourself and how you came to the University of Maryland and how you grew into this role?
Okay, so I am actually from Maryland, and I went to medical school. I went to Howard, so I was pretty tied to the area. I trained at Jefferson in Philadelphia, but after my training was over, I sort of always knew I was going to be coming back to Maryland. And one of the things for me about specifically CL psychiatry is being in a hospital setting. And I have always felt like teaching future psychiatrists and really molding the learning that goes on in training is a part of my natural calling. And so academia seemed like the place for me. And so University of Maryland was one of the places that I considered, and ultimately the place that I ended up taking on a faculty appointment.
All right, superb. Now, since your time starting at the University of Maryland, and one of the first things you touch on in your article is this, how we see things, if you will, when our colleagues leave. When we are there and we see our colleagues leaving for various reasons. And I wondered if you could just kind of comment on that and start to really, so that we can help the audience think about, or maybe increase their level of awareness as to why people are staying. So please go for it.
So I can kind of talk about my personal experience because that's the thing I know best.
All right.
For me, staying in academia has not been an easy decision, even though I feel a call to teaching and I like the sort of setting in which you're molding trainees and you're also engaged in academic work and sort of working more directly with your colleagues. It's not been an easy road. And as a lot of conversation is coming out about sort of systemic issues in academic medicine, it sort of for me was a journey of, I really don't know what else I could do and where else I could do what I feel my natural talents bring to the table. Where else could I do that? And ultimately for me, that was the centering point for why I decided, well, I have to be in an environment like this, because I don't think I can actually do my job and fulfill my career in any other type of setting. But that wasn't an easy sort of place to conclude. That took some reflection and some introspection.
Okay. You know, as you speak, Dr. Forrester, I think about that and I go back to your article. We're at a time where people are now looking at race, ethnicity, whether systemic racism. We're re-examining a lot of things. In your article, one of the things I really liked was that you touched on the idea that this comes up every time somebody leaves, or if you have a rush or a big group of underrepresented minorities leaving. And depending on how long one has been in the field of academia, you will see this at this point in time, cycles. I can actually recognize it. I started at GW in 2006, straight out of CL Fellowship, go team. All right. So at this point in time, I've seen, similar to you, I've seen people come, I've seen people go, and I've seen many of the same issues brought up in regards to why did we lose them, or why didn't they stay, or did we give them enough support, or did we do that? And which I think let me be clear, these are sincere discussions. People are forthright with it. They really want to understand it. But as you said in the article, which I want you to comment on again, because I've had this experience too, it's short-lived. I will see this spike, and then I will see it come down. And you had such a powerful question. You were forced to ask yourself, at the stage of your career in academia, because in academia it's like publish or perish, but I would dare say, as a faculty member, it's grow and expand, or you die, because there's more than one way to say in academia other than publications. But again, people are wondering why is this occurring, or things of that nature, and why people are choosing to stay. But I would argue that at every step of your career, you're asking that exact question that Dr. Forrester was asking, why am I here? Why is it that I have to be here to do what it is that I've been called to do? But could you talk a little bit more about that, if you will, that when you see colleagues go, or this ratcheting up, if you will, of concern, and then a dying down of it?
And sort of that experience is so poignant as a minority faculty member, because you really feel the loss of other people from diverse backgrounds when they go.
Yes.
Not only just because they're underrepresented, but because they were sort of colleagues in a different way a lot of times. And those cycles happen that you describe. Sometimes it happens in crops. Sometimes it happens where one person leaves, but their sphere of influence was quite large, so that their presence and the lack of it is really felt. But it's sort of a double hit as the minority faculty member who is staying, because that, even if you didn't work with that person leaving means something different to you. Yes. And that is what I felt. And then when the conversations start to happen, it's okay, well, why did this person go? And I agree with you. There's a sincere effort to try to understand, but because there's so much else going on and others may not be experiencing that same double hit, the conversations are briefer. And then you have no one to process that with. You feel like, okay, well, what are we going to do about this? Does everybody feel this loss the same way that I did, to the point that they would say, well, we have to do something about this? And unfortunately, the answer is most of the times is no.
Excellent points. And when I think about these cycles and people in that double hit, and I was starting to think about the evolution of my own career, I definitely think, and this is maybe just in academic medical centers in general, I personally think that depending on one's take, certainly every 3 to 5 years, you're going to have to re-up. You're going to have to decide why you're staying here. And I also, you pointed out some reasons that people in and of themselves might choose to go. in regards to feelings of invisibility, lack of mentorship, lack of being heard from leadership, coping with the burden of microaggressions. And maybe we might want to pause on that one for a minute. We're going to come back to that. As you were talking, one thing I would like the audience to also think about, and this is important, it's not just if minority faculty, in my humble opinion, if they lose other minority faculty, but take a real close look at everybody else who's being lost in the department. If you are losing people that you have a shared sense of mission with, that you have a shared sense of purpose, that affects everybody, but particularly it can affect minority faculty. So I bet if you go back and you look at a lot of unexpected losses, you're probably going to look at, wait a minute, hold it. That person left because they weren't satisfied with the care on the inpatient setting. And that was a mentor or a leader in this aspect. They weren't a minority, but they were influential, they were outspoken, and they had a shared mission. And my thought is that you can certainly hit a critical mass or inflection point of all of this. And inevitably, when does all of this really, really happen? Because it can actually occur at no other time. It occurs during a time of crisis. I think about that in terms of the CL service. I always tell the residents, you know what? You're going to get a call. Yes, you're going to get a call at Friday at, I'm going to say 4:45, 4:55. And it's going to be a consult question. And it's going to be a really vague consult question. And you're going to be like, no, but I'm ready to go. I really want to go. Okay. But either that consult is going to be the easiest consult of your life, or it's going to be the absolute worst consult of your life. But either way, you're going to have to make a choice whether or not you pick up that phone. That's kind of what I feel like happens. Like those points of crisis, they happen at all of these things happen at the worst time. And that's because they're going to happen. But that affects our faculty and how they stay. But it's more than just, it's in addition to losing minority faculty. But could you comment a little bit? Let's talk a little bit about that, a bit of that double burden of microaggressions. Let's talk about that a little bit. Go ahead.
Okay, so I think that microaggressions as a concept is something that people are at different levels of awareness about. But if you are a minority faculty member in an academic setting, one of the things that you become acutely aware of is that you may be having experiences with colleagues, other medical professionals, just people in the hospital because of your status as a minority person. Mm-hmm. And so examples of, I am engaged in a lot of sort of online activity. I see just conversations about parking in the doctor's lot and being questioned by the attendant about whether or not you're supposed to be parking. Mm-hmm. So that's even before you've entered the hospital or your clinic space. Having your clinical judgment be questioned. Not only by other physicians, but by like support staff. And you're kind of like, well, why is this happening? And then as you're moving up in terms of like degrees of importance, maybe not feeling like your direct supervisor or your chair or your director in your clinic space or wherever it is really understands who you are and maybe treating you in ways that you think are unfair. Mm-hmm. And that sort of level of uncertainty, that place that we exist in all the time of sort of, what was that about? Mm-hmm. Why did that happen to me and not someone else? I've been in faculty meetings where I've described interactions and I'm like, so has this happened to everybody? And I get kind of a blank kind of stare or no. And then it's sort of the conversation ends and you don't know. Your mind, you know, but you don't really know. And that's a very, very difficult place to be in every day. That's a stressful setting.
It's stressful. And in terms of, look, questions or anything of that nature. But what I would say is what you said resonated with me in a way in which I definitely think about it, like that microaggressive part is the subtleness of it, where it can absolutely go, at times it can be a bit more overt, but it can go unnoticed. Simple things such as, if you will, you're going around the table and everybody's commenting, but you tend to be the last person and maybe you only get 30 seconds and everyone else got X, Y, or Z. It may go like that. That's an example of a minor one. Mm-hmm. I think a major one is when your leadership is questioned, particularly when you're in a position of leadership. Mm-hmm. You find that you have to outright fight for something that should be either apparent or just direct. So these aggressions range from micro to overt, but it's the addition of them over time. And I think that staying in academia certainly can have a cost, because in my role, when I see medical students, I'm the privilege of, like, being a dean in terms of working with medical students, residents, junior attendings. And I can tell people that this starts to add up. So back in the day, people would say, like, oh, you got to develop a thick skin, you got to do this, you got to do that. Well, you know what the problem with that is? And maybe we'll start to question this in this current generation. That comes at a cost. You still have to pay a cost of dealing with those microaggressions. So actually, that kind of brought us back to perhaps why our colleagues, one reason why they choose, because that microaggression, like, you think it was that last, why did they leave because of that? That doesn't make sense. It wasn't because of that. It was because of every single thing that was before that, and they were exhausted with it. Mm-hmm. But we talked about leaving. The focus of your article was why you stay. Mm-hmm. So let's get into that. Why is it that you stay? Because I highlighted that, I bolded it. I was like, oh man, I felt energized by it. I was like, man, I'm ready. I'm about to dive back in. Go ahead.
Yeah, I stay because for me, it is critical that my voice is heard. And mm-hmm. and one of the things about representation, right, is that somebody has to be there to represent you. Right. And at a certain point, you have to really deal with yourself, because you're in this already stressful sort of mindset. You're dealing with things that you're sort of uncertain why they're happening to you. There's a cumulative effect. For me, and it may just be sort of my inner optimist, I don't want to be sort of like the crusader for everything, but I understand the importance of having a voice. And mm-hmm. I understand that there is something that my unique perspective, the way that I look at things, sometimes I'm in a meeting setting and I'm like, wait, I'm not really that smart. Let's break this down. Mm-hmm. And I'm like, let's talk about this. And I may be adding something to a conversation that never would have been added if I wasn't sitting there. Mm-hmm. Mm-hmm. And so I think about that all the time. And, I've seen the benefits of that representation. I've mm-hmm. seen it sort of grow and sort of produce good results. And so for me, at least now, that's something that reinforces for me that this was the right choice to stay.
For me, when you speak, Dr. Forrester, you talk about that voice and putting that voice out there. Something else that you put in your article that I personally think about in a very, I would hopefully say, healthy, selfish way, narcissistic way. Man, I say because of the trainees and the students and the colleagues. I will tell residents frequently, as well as medical students, if there's anything that I have, most of the best things that I've had the privilege to do in medicine have always involved residents. Like, well, Norris, you sound kind of amped with this. We don't know where you're going with it, but we're behind you on it. The memories that I think about right now are not, awards or things like that. It's the experience with residents. Our chairman, Dr. Griffith, said one time, and this gets back to your idea of voice. One of the biggest things that we're ever going to do is contribute to our residents and our students' education. And if we can take a small part in that, that leverages in a small way our impact. So when I have a resident reach back out to me, when I have a student reach back out to me, that's what keeps me in academia, heavily. And I recently went back to the hospital because I've been in the dean's office, but I miss that. I miss that energy from it. And that is, to me, another way in regards to how we get it voiced. But another thing, though, that's very important, I want to just kind of come right out and confess, compared to some of my other colleagues at the GW School of Medicine, such as Dean Yolanda Haywood, our Dean of Faculty Affairs, as well as Diversity Inclusion, as well as the Student Affairs Dean. She is, she's the best, straight up. But I feel like one of the reasons I've stayed is because I had people like Dean Haywood, also Dr. Marie Borum. They were carrying a lot of this mantle of fighting the fight, so to speak. And I was given a little bit of time and space just to grow. Mm-hmm. So I can't say that's everybody's journey. And I'm similar to you, Dr. Forrester. I'm just actually speaking my own journey. People can agree or disagree with it, but I'm saying in my heart, I feel like I was given a bit of a space to grow because I didn't necessarily have to step into this lens or being the person always on the front line. I purposely chose. I'm a CL psychiatrist who likes to train and work and this, that, or the other. That was my first thing. But I think other people I was granted a space to grow. And I think that's an important thing. So I personally feel like I didn't always get those double hits, but that's presently changing for me right now.
Mm-hmm.
I'll get into that in a minute. Another thing that you talk about in regards to, if you will, is why you stay, is a sense of responsibility to your fellow colleagues, particularly minorities that are already there, and a sense of camaraderie. Can you speak a bit about that, Dr. Forrester?
Yeah, I mean, one of the great things, and I want to echo your sentiments about sort of working with colleagues and feeling like that sort of sense that you're energized by the environment that you're working in. One of the things that I've been lucky to experience in the time that I've been here, and I've been on the faculty for 8 years, is that I've met really good people. Mm-hmm. And every time we have sort of had this opportunity where like the group of people was more diverse and there was a lot of different voices and opinions, and the work was easier and mm-hmm. it felt more rewarding. Mm-hmm. And so I still work with good colleagues and I still like my work, but there was an additional layer of satisfaction that happened when I kind of felt like our environment and our core faculty group was more diverse.
Okay. And say that again, Dr. Forrester, important point.
Sort of an additional layer of satisfaction.
An additional layer.
Yeah, that comes with that. Yeah, it just makes the experience so much more well-rounded and enriching. And I think that also reflects on the trainees, because one of the things that we're learning is that trainees really value that, and they really value different opinions and different expertise, and to have a diverse set of faculty that are training you makes you a better psychiatrist or makes you a better doctor in general.
No question. Let's get on trainees a little bit. Mm-hmm. How do you feel, because this is one of the reasons you stay, the trainees, how do you feel that trainees benefit from having a diverse faculty, in your opinion?
I think the benefits are so numerous.
Yeah.
I think one is, a lot of the experience that a lot of colleagues talk about is that, so if you have everybody in one environment and say people are all trained in the same place and people just have stayed for long careers, when you get somebody that comes in from the outside, we're not even talking about ethnic background, but somebody who's trained somewhere else, they say, well, oh, okay, but when I was here, we did it this way. And it opens up a whole new conversation, and people are able to think about a problem differently, even if they don't change what they did. The conversation opened up and your mind opened up. The same goes for being trained by people who are diverse in terms of their ethnic backgrounds or sort of where they come from. It's just that they bring something new. They allow you to open your mind differently. They engage with you differently, and you respond differently because you are getting direction, information, teaching from people who are not the typical archetype of what physicians are supposed to look like. Mm-hmm. And so that just that intrinsic process changes a resident or a student. And you don't even know sort of the downstream effects of that. Mm-hmm. But when we're looking at healthcare disparities, when we're looking at sort of poor outcomes for people from underrepresented backgrounds, you never know what sort of benefit a trainee who was trained by somebody from an underrepresented background could have 5-10 years down the line in taking care of a patient who looked like that person, or that person was able to bring something different to that trainee's mind.
Dr. Forrester, talking about diversity and talking about why we stay, again, this theme of why we stay, what do you think, maybe a tough question that come in here, but we're going to ask a few here. What do you think that leaders get wrong when they're trying to figure out, how can I keep underrepresented minorities or faculties? What do they get wrong? What do they miss? I mean, again, look, y'all, we ain't pulling out no evidence-based thing or whatever. This is just two CL psychiatrists talking. Yep. So I mean, keep the heat, text and emails down. I'm just putting it out there. Sometimes we get a little heat on MDEdge. So, but Dr. Forrester, what do you think that people get wrong?
I think in general, we have focused too much on numbers. So we have X amount of men and women and minority people, then we get stuck in the categories. So how many underrepresented minority in medicine, and what is this person's actually ethnicity, and how do we count him? So we get stuck in numbers. And what I think I would encourage anybody in a leadership position to do is really evaluate not only who is there, but the culture and the climate and who it supports. Because we can recruit many people from many different backgrounds into a culture and a climate that will never support them, and they will ultimately leave. And so because the form of what we have been doing is to look at numbers and recruitment and sort of say, we need X amount of people, without doing sort of that background analysis of what is the culture and climate here. And is it supportive for anybody new that's coming in, much less somebody who is from an underrepresented background?
I really like what you said so much. Let me see if I can go there. What do I think that leaders miss? You hit yes, you have to, or do we have to think about numbers? Sure, but let's leave that alone, because you hit on something very important. People miss that one of the reasons people stay is because of your mission as expressed for your daily behaviors as well as your culture. So I'll make a very, in my mind, blunt example. I don't care how protected I was or X, Y, or Z or what have you. If I'm in a center and I see patients that look like me, talk like me, whether or not you think they do or not, but if I see that and I see them being misrepresented, if I see my environmental staff being mistreated, all of these things, that has an effect. That has a very big effect, because that speaks to me what I sense as what is the underlying culture and mission, which is what you're getting at. Mm-hmm. So again, it's not, you don't have to, I mean, one, I don't think there's like a bevy of like we need more Black male psychiatrists. Well, we're a long way from that. But what we need is culture. We need along with stuff, but we need more culture and people aligned with their mission. And I think that's another thing is, and I'll comment on that a minute, is if people were recruited for one reason and the mission was one, and then there's a mission flip. And for many of us, the reason, I mean, let's face it, we're in academia, so we're underpaid. I mean, for most of us are. So what we are here not for money or things of that nature, but definitely with that sense of culture as well as mission that aligns with our values. So we talked about what do leaders miss. Okay, here's a tougher one. Well, maybe not tougher. What are opportunities that we miss to find reasons to stay as minority faculty? That's tough.
So I think that internal examination of what your actual mission and what drives you as a doctor sometimes get lost because of the levels of stress that people face. Sometimes it's hard to really do that level of self-reflection. And as I said, that was hard for me. So when we're stressed, we tend to kind of rely on different aspects of our decision-making that may not sort of take us back to a core mission. Like, why do I do this? And you may just sort of come up with your reasons. You may say, today I've had it. Like, I had an interaction and it built on all the others, and I'm just done. And I've also kind of seen from people that I know who have left academic settings that they go on to different jobs, and some people job hop because they still haven't figured out what it is internally that drives them and what would have them be satisfied. A lot of people leave medicine altogether, which is a sad sort of place to be, given what we put in for training. And some people find a better place. Like, that happens too. But I think it's because of that level of stress and sort of maybe not feeling as supported, maybe not reaching out to really seek support or describe what sort of support you actually need for fear of reprisal or feeling like it's not going to be heard, that makes us make decisions without really taking into account our core mission.
And as I think about that, probably the biggest thing that I think about is the reaching out, the staying siloed. And I mean, literally, you're right down the street, but we don't talk. I mean, you're a CL psychiatrist. So how do we actually, I think that opportunity to find, or better yet, understand, I like what you said, introspection, because this is not a knock on anybody who stays or leaves, because there can be various reasons That could be the right or wrong decision in various ways. But if you haven't done the introspection, then, and usually a good way to do that is to talk with folks, and I would dare say outside of your institution, because I know I can have blinders on a lot of times, but to talk with folks outside of your institution, and that becomes huge. The other thing that I think about is it's knowing when your mission is done, which is like, then when it's time to take on a new mission, maybe in a different setting. So maybe you leave that setting, but don't necessarily think that there isn't another place that you can go or whatnot where they're not doing that work. So I definitely think about that. I want to now go to this idea about, and again, just looking at your article, we've talked about the not challenges, a host of things that minority faculty in academic academias, but academic psychiatrists face. We've talked about, if you will, your reasons why you stay. And again, I encourage everyone to read the article. And we asked a few tough questions, perhaps in regards to what leaders are missing, and then what our faculty, maybe questions that they're not asking. Now, the next thing I want to do is have us to reflect, because in the article you say, to my colleagues who have chosen to leave, I say, I understand you did what you needed to do. Words cannot express what it was like to watch you go. And yet I say, hoping that one day the reality that you could not abide will be shifted and no longer tolerated by those who have benefited the most from its existence. Can you just kind of give us a little bit behind the scenes in terms of that particular last paragraph as we reflect upon that, Dr. Forrester?
Yeah, I think that as for all the things we've mentioned before, it's a complicated issue, and it's never a right or wrong whenever somebody decides to either stay or to leave. But as a person who stays, and we've talked about that double hit, wow, like you sort of understand, but you just wish it could be different, because you understand sort of what that richness of having so many different people from different diverse backgrounds being in one environment looks like. But at the same time, I want to acknowledge that there are issues with the environment that make it more toxic for certain people, that make it difficult, and that there are some that benefit from that, because for all of the structures of how medicine sort of has originated in this country and sort of how we practice, there are certain people that tend to get ahead more and sort of are in leadership positions. If you look at sort of chair of departments across the country, if you look at training directors across the country, there's a certain sense that these are the people that we want to see in these positions. So that message gets reinforced. And then, so for our colleagues that choose to leave, I understand what that is. But at a certain point, the folks that have reaped those benefits do have to reckon with that.
Correct. Dr. Forrester, you really have shared with us a lot. You've given me a lot to think about in regards to, again, asking that pivotal question, why? And regardless of where you're at, what institution you're at, where you're at in academia or not in academia, community, private practice, you name it, the government. This is an important question to ask. Why are you here, particularly in the midst of a coronavirus pandemic, a suicide epidemic, a cauldron where we're dealing with issues of race, justice, social determinants of health. Dr. Forrester, you've really made us think, and in your, just looking again at your piece, I would definitely say that just talking with you, you certainly, your career definitely is about transformation and demonstration of what commitment to representation looks like. And I certainly thank you for sharing that with us. And to everybody listening to this Psychcast, make no mistake about it, whether Dr. Forrester or I leave or stay, or our colleagues leave or stay or whatnot, please understand that we are all still unified. We're just doing it from a different, if you will, position. So I think that we want to make sure that that gets across loud and clear. So whether I'm at GW or I'm gone, you better believe, though, that still pivotal inherent mission is going to stay the same. Dr. Forrester, thank you so very much for being on the Psychcast with us. Definitely have to have you back just to get more of this, just to get more of it. And not because you're a CL psychiatrist, just because you're very powerful, powerful ideas that we would benefit from. So thank you so very much.
Thank you, Dr. Norris, for having me. I'd love to be back.
And that's a wrap on episode 132 of the Psychcast by MD Edge. The Psychcast is produced by MD Edge editors Gina Henderson and Jeff Bauer. All MD Edge podcasts are produced by executive editor Kathy Skarbeck and the senior vice president of editorial for Medscape, Dr. Ivan Aransky. The host is editor-in-chief of MD Edge Psychiatry, Dr. Lorenzo Norris. His guest this week was Dr. Anique Forrester. I'm your audio editor, audio engineer, and the voice of the Psychcast, Nick Andrews.